feel free to start.
Well, hi everyone. First off, hi Anne. My name is Kunal Naik. I'm the advocacy manager for PILS, the leading NGO in the fight against HIV in Mauritius, and also partner member of IDPC. I'm also the sub-Saharan representative on the Members Advisory Council for the International Drug Policy Consortium. I'd like to welcome you all on this occasion of the World Day of Social Justice, which was actually on Saturday. I'm going to have a conversation with Anne Fordham, the Executive Director of IDPC, especially to look at the role of drug policy reform in advancing social justice and how IDPC's new strategy seeks to translate this imperative into collective action. Anne, over to you. What is social justice?
Thanks, Kunal, and really, first of all, just to say thank you for agreeing to do this Facebook Live event with us and to have this really important and timely conversation on the occasion of World Day of Social Justice, and to discuss how drug policy undermines, I think, social justice outcomes. But yeah, I think it was quite interesting in preparation for this discussion. I sort of tried to do some research, really, because we talk about social justice and it becomes this term that we use very loosely, and I feel like we think we understand what it all means, and it was quite an interesting exercise for me to really sort of delve a bit deeper into the understanding of social justice. And I think at its very core, it is about the fight for equality and the fight against all forms of discrimination. A strong focus on protecting and ensuring human rights, fighting against poverty, ensuring gender equality, sort of looking at structural oppression that leads to the exclusion of certain groups, and ensuring social protection. And I think that when we talk about social justice, that's really what it means to us at its center.
Thank you, Anne, for this definition. I forgot to actually explain what the Members Advisory Council actually does for IDPC. Basically, the MAC, as we call it, provides key insights on policy analysis and development and contribute to the global strategy of IDPC. And especially the new strategy of IDPC has actually been focusing on, well, drug policy reform is a main part of that, and it's linked up. There's some intersectionality with social justice and what it means for advocates around the world, including the various members of IDPC. Anne, what would you say are some of the most pressing challenges in relation to drug policy, especially in terms of social justice?
I mean, yeah, I think, punitive drug policies, I think, have been overwhelmingly punitive and repressive in how they've been carried out pretty much in all parts of the world. And, they have detrimental outcomes on human rights, on health, on the well-being of communities in general. But I think when it comes to this question of social justice, I think what we know is that the brunt, the burden of these punitive policies have been borne predominantly by people who are already marginalized, who already face many forms of, sometimes intersecting forms of structural oppression, whether that's gender-based violence, xenophobia, racism. I think it's, these questions have become much more importantly so prominent in drug policy debates of late, increasingly. And I think, these questions now need to be addressed when we look at the criminal justice, the negative criminal justice impacts, in particular, of drug control policies, the issue of mass incarceration, arbitrary arrest and detention, extrajudicial killings in some parts of the world. Who is being caught up in the sharpest edges of the war on drugs, if you like, and how do we understand that their discrimination, their marginalization makes them ever more vulnerable to the most punitive aspects, repressive aspects of drug policies and punitive drug policies. It's, you know, punitive drug control is so pervasive. And I think, you know, I want to applaud also, I just want to mention here, our colleagues at Drug Policy Alliance recently, just last week, released a new initiative called Uprooting the Drug War. And there they look at, you know, how the roots of the drug war have become sort of embedded in the US in particular, and access to housing, access to education, something else that, you know, we've also talked about before, immigration status. Like if you have vulnerable immigration status and you end up being, you know, caught with drugs on your person or using drugs, you know, how vulnerable you are then to having that immigration status questioned or challenged or taken away from you. It is so pervasive. And I think the other thing I wanted to mention, Kunal, is, you know, a discussion that is, I think, coming to the fore of drug policy, but in many areas of social justice, is this idea of decolonialization. You know, drug policy has a very strong racist and colonial underpinning, in fact, and the current drug control regime is a really clear example of that, you know, going back to when they were first devising a system of global drug control, who was at the front and center of deciding, you know, how that system was going to work, which substances would be brought under international control. And, you know, interestingly, it was predominantly countries in the global north that decided which substances we brought under international control. They, you know, made decisions that basically meant that many plant-based substances, drugs, namely coca, opium, and cannabis, would be brought under international control, completely disregarding traditional, cultural, religious significance of these plants for many communities around the world. You know, that still persists to this day. And, you know, I think there is a direct conflict between the rights of indigenous people and the international drug control system, which hasn't received, I think, enough attention. And I think is an area, you know, of social justice that I think we also need to be talking about a lot more going forward. There's more to say, but I also want to kind of hear your views on what you think the most pressing social justice challenges are when it comes to drug control.
Thanks, Anne, for this. I mean, I totally agree with you, especially about the decolonization aspect of a drug war. I know you wrote a really interesting blog last year, and I encourage people to actually go back to that. It's on the IDPC's website. And you touched on some relevant key ideas, and especially for someone who's coming from a country who's part of Africa. The decolonization of drug laws is extremely important and needs to be high up on the agenda, because from various discussions we've had, I mean, I co-wrote the Sub-Saharan Africa chapter in the Harm Reduction International Global State of Harm Reduction report last year, and you can see this disconnect from what's actually happening on the ground and what needs to be done. And drug policy has actually created various barriers for people who actually vulnerable communities, marginalized communities, especially people who are using drugs and people who are living with HIV, to get access to key essential services that they desperately need. And these stem from the fact that there's a misunderstanding of what drug policy should be and what it should entail. And from an African perspective, there's a lot of political leaders, religious leaders who are dead against ideas of harm reduction because they think it's a Western idea being imposed, when in fact it's not a Western idea. For me, it's a common sense idea. It's a human sort of idea that it can actually help others. But the fact that it originated in the West, the political leaders tend to mistakenly associate it with a Western idea, when what they should be doing is challenge the Western ideas of the colonial ideas of war on drugs and the policies that have been implemented. We need to question that, because at the heart of an African culture is basically helping each other, but it's being alienated because of obviously the drug war, which has been peddled for so many years now, and especially various campaigns that have targeted like key communities, and we've messages that have been embedded and actually just socially constructed towards pushing people to keep marginalized communities away from services they need.
If I could just quickly add to that as well, Kunal, I think it's such an interesting point that you raise, you know, and I think that's why the decolonializing or colonizing conversation is so important. You know, I'm actually sitting in Thailand right now, where I'm also originally from. And, in Southeast Asia, we have some of the most punitive drug control policies in the world, particularly around like compulsory drug detention, high rates of incarceration for very low level offenses. And also here, the conversation has been very similar to what you've described about harm reduction being seen as a Western concept. The concept of human rights also here is very contested, seen as a Western, imposition. But, we need to unpick that consistently and say, well, also drug control, the way that you currently understand it, was also a Western imposition. And that, it has been taken here in many of the countries to the region to the nth degree without challenging or questioning the roots of drug control here, where there used to be such high tolerance for traditional use, particularly of opium, particularly of cannabis, and interestingly, just to say, because it's not, we focus a lot on the negative, all bad news, right? In terms of the cannabis discussion, I think it's more complicated than that in terms of viewing the possibilities of the cannabis market. But I do think it's interesting in Thailand, for example, as we move towards cannabis reforms, one of the big discussions has been around traditional use of cannabis in Thailand and reclaiming that tradition and that place for cannabis in this society. So I think that the conversation is opening up more. But yeah, I just wanted to draw that parallel between Africa and Asia as well.
Thanks, Anne, for that. We'll talk more about what we've been doing in terms of challenging the status quo in terms of the drug war later when we get to that part. But coming to what would you say is IDPC's role in addressing that, and also the fact that IDPCs just rolled out the new strategic plan, which we as MAC members got to comment on and actually contribute to. What would you say is IDPC's role in addressing that?
Yeah, thank you for bringing up our brand new strategy, which we just launched. Just 2 weeks ago, and very excited. It's a 3-year strategy from 2021 through 2023. As you point out, Kunal, there was extensive consultation over a year with the whole of the IDPC membership. Those who wish to engage and comment on it, and then extensively, as you say, with the Members Advisory Council, also to comment on many different rounds of it to get to the sort of guiding document that we have today. And I think we've also updated our vision and mission. So our new vision really, is around drug policies that advance social justice and human rights. And I think that really is where, we see our work, where we see the focus of our work, to really strengthen and continue there. IDPC, our role is, we are first and foremost a network, and it's about, connecting this huge network of incredible activists and advocates to one another to build, this momentum for reform at all different levels, to connect the debates that are happening at the global level to the debates that are happening at the regional and national levels, and vice versa. That's quite powerful to be able to link all these activist people, but these situations, these reforms, people can share lessons learned, they can learn from each other, they can be inspired by, reforms that are happening elsewhere. They can understand that, people feel part of this shared struggle. And I think also part of the social justice work means that we have to put communities and the voices of communities front and center. So I think where IDPC is also, really, and it's also a key strand of our new strategy, is about holding civil society space. So we know that's increasingly under pressure, making sure that civil society have access to the policy-making forums, the discussions, and are able to meaningfully feed into that. But beyond that, making sure that the communities who are most affected from the ground are also able to be present and participate in that discussion. And I think going back also to the solidarity point, for IDPC as a network, and I think you see this on the MAC, where in addition to having regional seats for members, we also have sort of seats for the populations that are most affected by drug policies. So a seat for people who use drugs, but also, you know, a seat for a representative of farmers' voices as well, because, you know, farmers who cultivate crops for the illicit market, you know, are also suffering huge repression. And you know, when their crops are eradicated, I mean, they, you know, their livelihoods are taken away. There's no meaningful alternatives. So I think building that solidarity between, you know, across kind of the different affected populations, people who use drugs, farmers, and all others in between, I think has been part of our work to kind of create that sense of solidarity and shared momentum and shared drive for change. But you know, you've also been involved with us for quite a while, Kunal, not
Actually,
just
yeah.
in your recent sort of position on the MAC. And I'd love to hear your views about, you know, what you think the role that IDPC has been playing in this space is.
Well, first off, I'd like to thank everyone from IDPC, because obviously I've been working with you guys and the Secretariat for the past 8 years now, I think, and on and off, like through the support of French campaign, which we'll mention in a bit. But for me, the value of IDPC has been instrumental in what the work I've been doing currently and the work I'm doing on a daily basis. And just to be part of that network and be able to connect with people from around the world and learning from shared experience has been tremendous in the work I'm doing currently. And also having that, knowing that I can rely on an IDPC and just like to connect with others and to build upon what's been doing, the momentum that's been happening around the world, especially over the past few years with the UNGAS 2016, and then the high-level meeting as well, which happened in 2019. These key events have actually, for me, been possible to participate in, especially because of the work that IDPC has been doing. And I think the strength of a network lies in that, the fact that we are all across the globe, but we can reach out to each other through emails and then actually connect on. Obviously now, obviously with the COVID, it's a bit difficult to travel, but we're using online platforms and talking to each other, I think, more regularly than we would have possibly because of meetings that are happening. But and as a MAC member, I should just tell you guys, I know it sounds like it's complicated, but we meet every couple of months. And we've got the incredible Jamie who coordinates the meetings, and Anne's present as well there. And there's someone from the IDPC board and other MAC members. There's 2 meetings that take place because obviously of the time difference around the world. And we basically just discuss about key aspects of drug policies and strategies we want to put in place. And at the heart of what we're doing now is basically the strategic plan. I still remember the meetings where Anne would keep coming up and adding new things to what was already discussed previously. But it sort of gives us the time to reflect on what's been happening and what we've been doing and how we can re-strategize to actually adapt to our time, especially in these troubling times, because there are a few things that are happening around the world that has been impacting policies and not just drug policies, but quite a few things related to human rights. And I think that's where we feed in, and that's the importance of the IDPC network, having that link with other causes that are being sort of people having to fight for other causes, and the intersectionality with drug policies, which is for me linked up to quite a few things in terms of human rights where we need to focus on. But
Yeah.
Anne, for people listening to us, yeah, sorry, do you want to add anything?
Oh, sorry, I was just going to say that, you know, that last point you make is a really important point that I wanted to lift up and reinforce, that I think our work is increasingly intersectional, and, you know, a core strand of our new strategy is also focused around sort of, you know, reaching out to other movements, finding common ground, you know, how we can support them, you know, how they can also be part of the drug policy reform movement, how drug policy intersects with, you know, the oppression that which they are resisting or fighting against. And, you know, one big key strand of our work for some time now has been looking at, for example, the drug policy impacts on women. And, you know, for example, here in Thailand, you know, the women in prison in Thailand, over 80% are incarcerated for drug offenses alone. That's huge, you know, but also, you know, other impacts on women, you know, what you talked about, Kunal, very uneven access to health services, the stigma that women who use drugs face, for example. So looking across all these different ways in which, you know, drug policies, affect women in particular. And then you know, through that work, reaching out to, you know, other actors in the women's movement, in the feminist movements, and finding common ground and linking up. But that's just one example of it. You know, I think the racial justice work is another area where, you know, there's been lots of discussion and scope for that. You know, this is not only our fight, and their fight should not only be their fight, you know, that we have to find this commonality in a pro-rights agenda, especially, you know, closing civic space, you know, a very strong anti-rights narrative coming out of many governments. I think we need to find that strong solidarity and alignment.
Definitely, I totally agree with you. And basically, for people who've been watching us and would like to be involved, how do we go about getting involved?
Yeah, so I think the first thing to say, and you touched on it earlier, is you know, the Support Don't Punish campaign. You know, we have thousands of activists involved now in the Support Don't Punish community. And every year, 26th of June, there is a big global day of action where basically anyone can get involved. We have a small grants scheme where people can apply to support their action at the local or national level. So that's one way to kind of, you know, be involved specifically in a strong campaign. But I also just wanted to say that I think, you know, you touched on it before, Kunal, this current COVID situation obviously brings numerous challenges. We cannot meet, we cannot hug, you know, it has been very difficult. But on the other side, there is, you know, this incredible opportunity of being able to convene online. It's much more accepted than before. It's much more flexible. You know, you can, you know, convene quickly in different spaces, in different places. And I think anyone who, you know, thinks about that, they feel like they want to have a conversation about drug policy and how it impacts on their community, how, you know, they might build solidarity with others. You know, you could think about convening a discussion online, for example, about drug policy, you know, have a conversation about what drug policy looks, you know, what the most pertinent issues of drug policy are within your country or your community, what the opportunities are for discussing reforms, which other stakeholders you might want to involve in that conversation. I think this particular moment lends itself to this kind of online organizing that makes numerous discussions and debates possible.
Thanks, and I would stress the fact that for me, Support Don't Punish has been instrumental in the work we've been doing in Mauritius and beyond as well, especially regionally with South Africa and also Kenya, where I was involved in advocacy around especially how to establish the harm reduction network and working directly with people who use drugs as well. And Support Don't Punish is one of the main things that I would encourage everyone to sort of rally around, and there's loads of resources online on supportdon'tpunish.org. You could always just send an email to Juan from IDPC, and just to stress the importance of Support Don't Punish. We've been doing it in Mauritius since 2013. The first campaign was then, and every single year we've innovated, we've engaged more people, and we've stepped up what we've been doing. We started off with a flash mob, and we went up to a conference where we got the Prime Minister to be there to discuss about drug policies, and we actually controlled the context to put drug policies back on limelight. And one of the key things that Support Don't Punish helped me to do as well is, with my other friends and colleagues from Mauritius, we engage religious leaders to actually discuss about drug policies, and obviously to try to distance ourselves from that moralistic language of drug use, and by showing them the history of a war on drugs, especially which you touched upon, and as being a very racist war, we managed to convince people who were dead against actually drug use, but then we shifted the focus on helping people who need the support of social support, health support, and a sort of a health-based approach as opposed to an oppressive approach. And it's actually worked. And we've got a few things lined up over the next few months and years. Hopefully, all the work that we've been building up to will be paying off, and we can become an example, as we used to be, for harm reduction in the region. And all of that's actually been possible because of Support Don't Punish. So thanks, Anne, and thanks for the colleague at IDPC, especially for putting all the materials we need, and for launching such an amazing campaign that all of us can adapt to our context.
Thanks, Kunal. Well, it's only as powerful and as strong as people like you know, leveraging it and sharing the knowledge and the lessons learned. I think that's been something that's been so wonderful about Support Don't Punish. I think it's this real sharing and learning community, and everything that you've just shared is so powerful. I hope for people listening who think, yeah, I'd like to try and, you know, do something to elevate this discussion, you know, in my context. So yeah, that's awesome, Kunal. Thank you.
So yeah, thanks, Anne. And again, I think we've wound up to 30 minutes. It was actually a very interesting conversation. There's so much more we didn't cover, but I encourage you guys to click on the links that one probably posted on the Facebook page. And if you want more information, you can always send a message on Facebook or send an email to IDPC. Thanks, Anne, and for giving me the chance to actually talk to you for 30 minutes on this. And I'd like to wrap up by saying, just keep the faith, guys. I know it's a hard, difficult time, but by joining together and being part of a network, of IDPC network, we can make things happen. Thank you.
Thanks so much, Kunal. Bye, everyone.
Bye.